Awesome, Mandy. Thank you so much.
Yeah, no, you're welcome. I just like I was saying, I don't know if there's some way you guys start off the study club. If it's
Well,
something you want to talk about, you tell me.
yeah, Michael is in North Carolina and Ryan is in, it's not Iowa. Help me out, Ryan.
Michigan.
Michigan. Michigan.
It's
Okay,
Yep.
Great Lakes.
Michigan.
Great Lakes, Michigan. So, yeah, so they both have done some treatment with their kids and maybe a couple of patients. And Mandeep is up in Canada and she's done some treatment with her kids and a whole bunch of patients and it's done kids and adults and really done classes with chiropractors and other kinds of doctors or physical therapists and a lot of other experience and training and teaching. So yeah, we're excited to have her and I think you guys will really enjoy what she does here.
Awesome.
Awesome.
So the adult training actually is funny that you mentioned that started because the results were so great with the kids. I was like, Nate, can I do this too? And he's like, why not? He's like, all my assistants are doing it, and I can't wait to share with you guys my case. It was amazing. Nate, I can't thank you enough. So I'm gonna go ahead and share. I don't know if I can. Yes, I can. Now I'll get started. So again, thank you so much for everybody for being here. The three areas that I treat, I'm a general dentist. My name is Dr. Mandy Johal. I practice in Toronto, Canada. And I'm so fortunate I met this wonderful man, Dr. Nate Tanner. Thank you so much, who introduced me to, in my office, we call it the Dr. Tanner Appliance, the Forward Growth Appliance. Those are the two names it goes by in my clinic. And with this, I have been able to further treat my patients with these three areas: tongue posture, balance occlusion, which involves the jaw, and airway. Because all these three things ultimately affect posture. So when Nate was alluding to me working with like chiros and osteos and PTs, it's because this is what we're working on. They're seeing changes from me changing their jaw and the patient's posture, but to take it further, they're working on their patients, either moving the jaw more forward, getting the posture right. So it's really cool how we can all work together, and that's what I plan on sharing with you guys today. So I'm not sure how much Nate has touched on this before, but when I present to chiros and osteos, essentially this to me is like our connecting piece as a C1. How are we connected to the chiro world? How are we connected to the PT world? Because they just think of us as teeth. They don't realize, other than like sleep and everything else we're helping our patients with, that we are literally helping them with the posture because of this one critical vertebrate, C1. And what's really interesting about the vertebrae is that each vertebrate has three prongs that it rests on, each one of them, except for the occipital. When it's sitting on the C1, it only has two spots. I don't know about you, but a two-legged stool is not pretty stable. When you get a three-legged stool, it's pretty stable. But the third leg to help balance that C1 is our jaw. So that's how I kind of tie it all together, is how we can really be changing and helping our patients with posture. Because a patient could be seeing, like going for adjustments, seeing a manual therapist, but they rebound really quick because we lock their cranial strains, we lock their posture as soon as they start chewing and biting down. Okay, so I just wanted to start with that, and this is another slide because I'm not going to dive too much into tongue ties, but literally the tongue tie world, if you believe in it or not believe in it, you can just look at dissections. When they look at the deep frontline fascia, the tongue tie fascia layer is connected all the way down to the toes. So whatever the tongue is doing, releasing it or not releasing it, it's the function of the tongue that is critical, for the whole body. It affects our diaphragm. I have pelvic floor therapists in my community that now are understanding the importance of tongue function. So we're working together. So this is also important, but again, not for tonight. We're not going to talk about tongue ties. So we're going to jump right into cases, like the real fun stuff. I wanted to share this case with you guys because this patient has had 2 rounds of ortho, and she's just like, Mindy, they just can't get my bite right. Like I just don't feel right. And she's some type of intuitive healer. I don't know what she does. She's a naturopath. I think she's a naturopath. And she's like, I just know something's not right. Like my jaw feels weird. I'm getting headaches. Can you help me with it? And when you look at her teeth, oh my gosh, she's a she's really pretty. Her teeth are gorgeous. They're so straight. And everybody's like, you're crazy. What do you want to move? Well, take a closer look. Poor thing had her upper buys extracted. And I was like, well, I think that's your problem, because if you take a look, everything right here, if you take a look at her upper maxilla, everything's starting to tip in. And I was like, that's your problem. Your upper teeth have extruded and they're lingually tipped, and now it's locking your lower jaw. And it doesn't look that bad, right? But I was like, if I can help move the jaw slightly forward for you, because it's in a really locked position, I think it might help your headaches. I'm not sure. I mean, I know it's going to help her, but we don't want to overpromise. But she didn't have premolars extracted at the bottom. So guess what? I only needed the Dr. Tanner appliance. So let me continue. So this is my patient, my adult patient, and I gave her two options. Either we reopen up the sites where the teeth were extracted, the fours, and put implants, or what I would do is I'd mesialize all the posterior teeth forward. It's a lot more work for us, but it's up to the patient what they want, because implants are costly and not everybody wants to do them. And I could tell you right now, bone is never an issue for when I open up extraction sites. Never an issue. Just a side note. I don't have a case here. I should put it on here, but it's never been an issue because this is literally magic. So this is my patient in the appliance. There's nothing really special about our appliance. I didn't really have any special requests for it. It's just adult patients. The difference between children and adults is they do not wear it while they're eating, but they're wearing it the rest of the time. And what I love about this design that Nate came up with is the occlusal pad, the occlusal coverage. The occlusal coverage, I really think, is key, because that's what really helps us increase that vertical, which I would say 90% of our population actually is lacking. And increasing that vertical, again, is helping us with the C1. So I think that's what happens when our patients wear this. I like them to wear it for 6 months if they have really poor posture, even if the site's corrected, because it really starts to change the posture for them. So this is my patient with the extraction site. So I didn't open them up like 8 millimeters. I didn't need to. I just needed them enough to see where her jaw wanted to be. And to me, I think that was the right amount of overjet. I'm going to make it even better. But to me, I didn't need to do any more forward growth with her. But what's really interesting and what's really genius about this appliance is I can change the angulation. Because she had teeth that had over erupted and lingually tipped, we were able to angle the screws so that we could get the premaxilla and start tipping it upwards. And look at the difference here. I think I might have slides of comparison between the two, but that's what I really needed to do for her to loosen up and allow that lower jaw to come forward. So you can see the extraction sites are open. This is her after the clear liner therapy, so she's really happy. You can see we closed everything up. Like, her bite looks amazing. This is just clear liners to close up the gaps. So I was pretty pleased. We're still fine tuning a little bit. Like, I feel like it's just a little too tight in this area, so we're going to loosen this up for her. Other than that, she is so pleased. I mean, I'm so pleased with how straightforward this case went for her. And let's go over some comparisons. I want you to see how much her lower jaw shifted forward. That's pretty significant. I didn't know this until I was putting the presentation together. Like, I knew her face changed, but to see that her lower mandibular wanted to move this forward was pretty amazing. But also, I closed the extraction site too. That plays a role in it. But remember, that was maybe like 3 to 4 millimeters. But you can really see that we moved her jaw forward, and you can see that her posture, guys. Look at her posture change. This is significant. This is enough to help somebody stop their headaches. And I didn't say anything. She's the one that said, hey guys, my headaches feel amazing. They're gone. My head feels amazing. I don't get headaches anymore. So it's just the postural changes. And what's really important to notice also is when you do a deeper dive into really learning about one of my favorite bones, I call it the hyoid bone right here. Look at the position of that too. That completely changed for her. And that's significant. So I know we don't have enough time to talk about the hyoid bone, but this is a really critical bone for us when we're looking at sleep apnea, especially when we're looking at postural stuff. And that was a significant change for her, lifting that up. And the hyoid bone, just a little thing, is attached to almost 12 different muscles. It's a free floating bone. Base of the tongue attaches to it. You got muscles from the front that attach to it, back of the skull, all the way back to the scapula that are attached to this tiny little hyoid bone. It's so significant. So any postural shifts that are going to happen is going to shift this bone. So we know that a lot of postural shifts happened for her. Look at the profile change. I know this might not seem significant, but her face looks fuller, you know? So this whole world of fillers and Botox, I mean, I'm not 100% on board, but I'm 100% against it either. I mean, you know, it's celebrities and mainstream that are doing this, but we can avoid and help our patients avoid it as well, because that's also very costly for patients to maintain and keep. If I'm giving patients growth in the premaxilla, if you were to study aging, the first bone that starts to reabsorb when you're aging is the maxilla. So guess what? We're giving them growth in this area and we're helping them with their posture, which also helps decrease aging. So it's a win-win. That's not the reason she did it. What's unfortunate is the shadowing. I wish I could show you like how much better her jaw looks. The pictures are everything. So that's what you're going to learn today, is take notes from how not to take pictures, unfortunately. So it'll get better because I can't be in every room to take the pictures. So I have different staff taking it. So we're trying to standardize it, but shadowing is difficult. So I wish we could see like how much better her jaw is, but you can see the premaxilla has really come forward. We didn't really get to do the comparison that I wanted to do, was to show you guys the change in this image compared to what she initially had right here. Like, to me, that's huge. It's less gummier. That's the word. So I'm so used to teaching like non-dentists right now. I apologize. But her smile is less gummy too, and that's really one of the other things that she wanted as well. So anyways, beautiful case. So we can do forward growth in adults. I have another adult patient here. He was pretty nonchalant. He didn't really have any concerns, but other than sleep, he just wanted to hit deep sleep. And I told him, like, I can do this, but I'm not going to guarantee that you're going to get deep sleep, because he had so many other stuff that I wanted to work on with him, but he didn't think they were important. But if you take a look at leveling of the eyes here, you can see that, one is lower, one eye is higher. He kind of had like a twitch in the one eye. I should have videotaped it for you guys. It's really interesting to see because that's gone. He doesn't even know that it's gone. But that's something I should really videotape and show you guys, because he's a big YouTube influencer, Evan Carmichael. And if you look at his previous videos, you can always see that he's like hyper talking and the eye kind of winks. And now when you look at him, there's a huge change. But again, he's not giving me credit for it, but you can see how I balanced his face. I want you guys to see this too. So he didn't really have any concerns. He just, hey, doc, this is what you want to do. Let's do it. A little nervous when people say that, but I knew I could help him with the facial balance and the posture. So let me continue showing you this. He did have a crossbite that I wanted to correct. So if you take a look at his appliance, look at the opening that I had for him. There's a reason why I had this opening for him versus for her, because I want you to remember this angle, and then I want you to take a, so this is my previous patient, and when you saw her appliance, her mouth wasn't really opened as much as Evan's is. So let's go back. So you can see how much more his is, because he is, I'm going to show you, look at his jawline, right? He's a vertical grower. So in order for me to change that jawline, I'm telling you, it's magic. And it closes up and the jaw shifts. I'm not going to bring you to it right away. Let me go. I'm going to show you the after, but I don't want to get ahead of myself. I just wanted to show you why this is open compared to other patients. So each treatment plan is different. You can't really mess up, which is the best part about this appliance too. I promise you, Nate didn't pay me to say all this stuff. It's just, this is how much I truly love this appliance, because it's so versatile for all patients. So anyways, he is a public speaker. Like I told you, he is an influencer. So he talks a lot, but let me tell you, he took it out when he was talking, but he wore it the rest of the time. And I was so impressed, because we were able to, instead of him wearing it for like 5 months, we had him go into maybe 8 months, which isn't too bad because of his travel and speaking arrangements. and we were able to open up spacing for him really nicely. I think we got spacing pretty much in a lot of places, so it's not periodontally involved. And there's no recession. So I post a lot on Instagram, and the first case that I showed you, oh my gosh, the trolls that I got about oh, you just gave her recession, you pushed her teeth out of the bone. Um, no, she has no recession. Like, it's so slow and controlled, and the premaxilla does exist, and it's magical. The space behind the distal of the threes is the magic spot. So again, he already had excessive recession. I was not about to give him more. I actually want to help prevent this, because the reason he has all these app fractures and recession is because his bite was so poor. That was really the reason, because a periodontist wanted to go ahead and do gum grafting everywhere. And I said, whoa, 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 hold on. Let's figure out why you have the recession. Let me help you with the bite, which is occlusion. If I can balance your occlusion, we can slow down the recession and then get all the gum grafting you want, because it's not pleasant. But at least I know it'll be more stable. So anyway, so this is after the expansion and before they go to clear aligners. Again, he wasn't missing any premolars, didn't want implants, so I didn't need to expand all the way. I just needed to get enough so that I knew how I do it is I see how far the lower jaw wants to go, and that's how I measure how much the upper should go forward if they don't have extractions, molar extractions. And you can see his overjet seems pretty significant, but when I had him protrude the lower jaw forward, it went like further than his front teeth. So I knew I was at a sweet spot. Let me show you. But look at the eye balance. Like, I was blown away. I was a little worried, because he really wanted, like, he's like, I only care about sleep, I only care about sleep, but he didn't realize like how we were able to balance his posture, and this will all help with his sleep eventually. But I'll have another slide to show you guys with his posture will help as well. But I told you, like we were able to close that large overjet. I mean, it's still a little bit there, but he has really good function, really good canine function. Um, like, he's just in a more comfortable position, but his jaw and his posture has completely changed, and the tick is gone, and the eyes are more balanced. And that's because of the occlusal coverage of the acrylic, of the appliance. Absolutely amazing. So this is before. And I want you guys to see the angle change. And again, you might not think it's huge, but this is huge. We're literally causing bone remodeling on an adult. If I could have got him to wear it for a couple more months, I think we could have remodeled even more. But you know, it is what it is. We can't get patients to see exactly what we want. So this is what we could get. But also look at the positioning of his hyoid bone. Look at the angle. I was able to change this. So you always want the posterior part of the hyoid bone to be higher than the anterior bone. Again, we're not going to get into it, but the fact that I was able to change that for him, I knew postural changes were happening. We were able to grow, you can see we grew the maxilla forward, we grew the mandible forward. We didn't grow it forward, it remodeled, plus also it was locked back, it moved forward. We were able to get huge postural changes, and you can see it further here. I know we got a hoodie. That's a big no. Please do not take pictures in hoodies or long hair. Always have them behind, or put them up in a ponytail. But you can really see that there is a big, big difference in the way he holds himself, the way he walks, his chest, his pelvic floor, everything has literally shifted for him. He is doing myofunctional therapy. He's scheduled for tongue tie release later on this month. And I think that's going to even have a bigger impact on him. But to me, I think that's a huge, big postural shift. Sorry, this line, why do I have this arbitrary line here? It's supposed to go midway through the shoulder up. It's this posture app that I have. And that's where this line is. So it's not just an arbitrary line. It's an app that I have for posture, and it finds that center and shows me the ears and the shoulders should be lined up. Okay, he does have a severe head tilt. You can see the way the ears are positioned, but they're also like that in this picture. That's just how he stands. So we're trying to work on that. He's trying to see more chiros and osteos. He is busy, but we've already seen so much change just with the appliance. So it's pretty cool. So this is something, again, they don't teach us in school, but guess what? They're teaching this to PTs, physical therapists. So this is from a physical therapist site and from physical therapist lectures, where they're literally taught to look at the patient's occlusion, that if they're a class 3, their center of gravity is going to shift, and this is what their posture is most likely to look like. Their class 2, center of gravity is shifting. This is what they're more likely to look like, which we already know. We see a lot of forward head postures in class 2s, and these are really majority of our patients. I rarely see class 1s. It's really important that we look at the body as a whole. You might see a class 1 with severe forward head posture. We should take a closer look. They're probably going to be a class 2. But I wish we were taught more about this and how we can connect the whole picture in the body as a whole. Okay, so here is another really amazing case. These patients drove, the whole family I treated, but I chose the coolest case from 3 children. And they drove from over 3 hours because they were told this poor girl had to get 4 bicuspids extracted for this case. And mom's a very holistic mom. She's a stay-at-home mom, and she's like, it just didn't settle right with me. And she found me, I think, through Instagram, that she saw like what I was doing. And I told her, thank God you came, because I could easily do this beautiful case without extraction. And let me show you. So, oh, I don't have a picture of her in the appliance. Okay, so this was she came in with, and we did actually, I think we did 2 rounds. We actually had to do 2 rounds of your appliance here, because she didn't have a lot of space for the canines. You can take a look right here. I still had to do even more. So we did 2 rounds of the appliance, the forward growth appliance, because I knew I had some space between, the diastema was huge as well. So I did another round, got her bite here, and then now she's in metal braces, but look how much more room we have. I know it was from the diastema too, but we still needed so much more forward growth for her, and we're not done still. But I mean, to me, this is remarkable. We're able to make space, and her bite's starting to look pretty good to me. Like on the right side is coming together, on the left side it will too once that canine comes down. This is such an amazing case where the patient is sleeping better. And the most important thing, she's only 13 and so self-conscious, because if you take a look at these pictures, you can see when you have an upper maxilla that's deficient, the upper lip always looks thin, right? And it's just because structurally it's not supported. So the way we talk to women, or we talk to young girls these days, is very important. I'm always reassuring them, like, they're absolutely gorgeous, and they're talking about fillers. I see what they're looking at on their TikToks and their Instagram, and they are obsessed with the Kylie Jenners and the Kim Kardashians to get those full lips. And I'm like, you have them. I just need to move your structure forward so your natural lips can come forward. Because if you were to look up what aging is, she's already showing all the signs. She has the jowls already. She already has like the caved in look at the age of 11 or 12. So I could see why she feels like that. And she trusted the process. And I'll come back to this. Let me just show you her face. This is 2 rounds of this appliance. And I want you to take a look at how beautiful the cheeks are lifted, the lips are supported. She just has this beautiful, beautiful lips, and no more of this jowl. Look at this. This happens when you're not supported structurally in the mid phase, and then everything drops. It would be even worse if she was in her 40s, where you would start seeing like saggy pop, like it almost looks like a saddle down here. So I was able to lift everything because, again, the appliance, I had it programmed so I wasn't just going straight, but it's going straight and up, because I wanted to make sure I gave her those cheekbones here. So let's go back and take a look. When she first came to me, this is what we were dealing with. You can see, you can take a look, like the canines are completely blocked out. That little diastema was not going to give me enough space. The other thing to watch out for these cases is the 12s, or sorry, the 7s. The 7 sometimes get locked right here. So if we waited any longer, she would have been one of my cases where this 12 would have been locked right underneath the distal of the 6. So it's really important we create spaces so we can prevent this from happening, because unfortunately I've had a couple of cases where these teeth have completely bombed out the 6s because they came in too late. You know, they're just like, oh, it's not erupting, and the child's 13 and they're totally bombed out. So crowding, we should always be taking x-rays and pans, and starting early. Here we go mid-course, the images that I showed you. So we have her in full matter braces, and we have enough room for the canines to come through, and you can take a look at what's happening to the 12. So there's enough room for them to come in as well. Because remember, this appliance not only does forward growth, I also got lateral growth with the appliance as well. She didn't need very much, but she needed some, and I think that's what really helped with the 7. So this is her selfometric x-ray. I know my American colleagues make fun of me, but this is all we can take in Canada. It's like a for them it would have been a 5-hour drive to get a full TBCT scan. I know you're not here for my rant, but it's pretty heartbreaking. I had to be very selective on who I sent for a full field CBCT scan. But anyways, sorry, thanks for a little 2-second rant. So this is her cephalometric x-ray. This is just mid-course. I haven't even taken the final yet. They haven't done any body work. Parents are very busy with the 3 kids. But she still needs a lot of work in her upper cervical. She is going more forward. I'm finding that the more forward growth I do, because I had to be pretty aggressive with her because of her age right now, I feel like it does take a toll on the spine. So when I do this appliance, I'm working really closely with chiros and osteos, because I know there's something going on with the spine when I do a lot of forward growth. A little bit, we're okay, especially for my adults, but for growing children at certain growth points, I feel like there's something going on with the spine. It's not a bad thing, it's just something to watch out for, and to work with a good chiro and good osteo to help, because I wish she was, this would have been in a better position. So we already went over the beautiful before and after. So here is another case where the mom came to me because he was not sleeping well, and they had a family of obstructive sleep apnea. But he's a good looking kid, perfectly straight teeth again. But mom just said, you know what, I just want to do whatever I can to prevent sleep apnea, because he has a carbon copy of his uncle and his grandfather, which I'm going to show you guys later. And I said, okay, no problem. And I think this is one of my first cases actually that I started with Dr. Tanner's appliance. And we did a lot of forward growth for him as well. I actually had him in a face mask, and then I put him in a Dr. Tanner appliance. Yeah, I did both. That's how much forward growth he needed. And that's the thing, like when we look at these cases, we have to take a history. You know, what's their sleep like, and do a deeper dive in their sleep assessment. And when you do that and you take a cephalometric x-ray, you're like, oh wow, they're really deficient. When you looked at his measurements on the x-ray, you're very close to what his uncles look like, because I'm treating his uncle as well. And that really sent a lot of alarms for me, because he's really, really mid-face retruded, like he's completely flat here. So he would have had no hope in the future other than a sleep app machine. So luckily mom understood, and she allowed me to do forward growth for him. And let's take a look. He was tongue-tied to the tip. It's the only tongue-tied case I'm going to do here, show with you guys. And he was probably 8 when he came to see me, and never had an issue, no speech impairment. I think it's when I first started doing them, I could have gone a little bit deeper, but it's really hard and tricky for little kids. So a little is better when I first do them. And then what I usually tell them is might need a second release later on, so which we're going to do later for him. But I want to show you guys something really interesting. So this is his before x-ray, and this is his after cephalometric x-ray. And I zoomed in on these parts because this is the uncle's CBCT scan, which I did get for him. I want you to take a look at the family nose here. And then this is his before. And the first thing the mom noticed was, oh my God, my son doesn't have a family nose anymore. That's because this appliance not only goes forward, it can also go up and literally changes your mid face, because this kid was presenting with a down and back facial growth pattern. I was literally able to change the trajectory of his growth during that growth period. That was the first thing mom picked up. I couldn't believe it. I didn't even pick it up. I didn't even look at that. I'm just like, oh my gosh, look how much more space we have. Look at the bite. It's not edge to edge anymore. So I'm looking at all these other cool things and the measurements, and I'm so happy with it. And she picked up the nose. So anyways, I thought that was interesting because that does happen for adults as well. It's just a little bit more obvious at this age. I believe this might be my last case, but I think my case is there too. So this is a kid that presented with poor sleep, and he has what's called high functioning autism. And, mom went everywhere, and everybody's like, he's totally fine. He has so much spacing. Um, Close up the diastema and you'll be fine. And she did not she knew what retractive ortho was. And I was like, oh my gosh, what do you do for a living? And she's a dancer. Mom's a professional dancer, ballet dancer, and she is a professional breath worker. So she got into the whole realm of botanical breathing, and then she learned about retractive ortho through one of the webinars. And she goes, oh my gosh, I can't believe they wanted to pull back my son's teeth back. Because take a look, like you can see he has a lot of oral dysfunction with the cheeks. So we had to do a lot of myo, but everything is back. So his chin is so retruded, and now they want to pull the maxilla back. I mean, poor guy with high functioning autism and poor sleep. Future wasn't going to look so good. So mom knew that, and so she came to me from all the way from Toronto, and so I was happy to work with him because when I looked at him and we did our prep work, we found that he was very mid-face retruded. He had the long facial growth pattern, which we needed to change. And I know this is his before and after, and I know he has a head tilt. It's not apples to apples, but still, I need you guys to understand, like, we're able to create so much room and change his profile and change the angle of the jaw. We are able to give him a bigger airway. I mean, not this much bigger because I know there is a tilt, but he's definitely not this narrow anymore. And the biggest telltale is throughout the whole treatment, this kid never said a word to us, always unhappy, until we were done treatment, and he was just a totally different kid. He was like verbal, he was talking to us, you could just tell he was getting good sleep and just a totally different kid. So anyways, I just wanted to jump to that, but I'll show you the rest of the treatment. What else? Oh, and you can tell again how much growth we're getting by the 7s coming in and the 8s coming in. So anyways, again, I was really pleased with this. Oh, and the hyoid bone here is significant too, because you might say, well, this is higher, now it's lower. This is too high. This is not in the right position, actually. This is in the ideal position. You want it between the third and the fourth vertebrae. So this is in the ideal position. So again, we did a lot of postural changes. This is what we were able to do after the expansion. I created way, way, way more space for him. He really needed it. And here's a cool thing about treating somebody whose 7s are still erupting, is that you just allow them to erupt while they're doing mild functional therapy, and these spaces will automatically close, which is really cool to see. I'm so sorry I didn't include it in today, but his follow-up pictures show that these gaps are getting closed, and everything's just moving in so nicely and forward because we're able to establish his breathing and his tongue function, because I knew mom was going to deliver. But if mom wasn't in the line of work that she did, I would never have promised that to mom, because this would not have been a stable case if the kid could not correct his oral dysfunction and do nasal breathing. It wouldn't have worked. Again, you can see how open this is because of his vertical growing. We had to change the trajectory of the lower mandible significantly. So that's why you see this. And what's really cool when you start treating this, don't be alarmed. You can, coach the parents and coach the patient, just start eating slowly, but that bite is going to start closing down. So probably in 4 weeks when I see it, it's more than halfway. And then when I see them 8 weeks later from the initial appointment, it's closed. I actually need to make more room, or sometimes even build pads at the back. I used to build a lot more pads at the back. For a lot of my vertical growers, actually, I do that. But I don't really do that anymore for vertical growers. Sorry, for vertical growers, I do it. For my other patients, I don't. But it's a game changer on the way it changes your face. So again, you can see, yes, the diastema closed, but all I did was use the Dr. Tanner appliance, and that's it. I didn't use any clear aligners, no metal braces. Everything just came together the way it was meant to be. And yeah, it's just a totally different kid. I love these cases because he was just so grateful, but he didn't really know. He was just so happy to come all the way. I'm in like Guelph, like I'm in Toronto, but I'm like um, an hour west of Toronto. Hour west of Toronto is a little town called Guelph, and he loves coming here because he goes, it makes him feel good. So I love these cases. Another close up of his appliance. This really helped this patient because it was allowed him to lift that tongue to the spine and play with this. The only thing with these appliances is it does eliminate space for the tongue. And, it is temporary, but in the meantime, for some kids that really do need a lot of myofunctional therapy or have a lot of oral dysfunction, this is something you could do, is have them extend have them play with this. So it helps lift that tongue and eventually teaches them tongue on the spot. So this is my transformation with the Dr. Tanner appliance. This image of me is when I first graduated 15 years ago now. And I was so excited because I had just learned, I went to Case Western and they taught us how to do clear liners. And so I did clear liners on myself because my parents could only afford ortho on the one child. My sister got it, not me. So I was like, yes, you know what? I'm going to do clear aligner therapy. And so this is my after of clear aligner therapy from straight teeth. This is me like last year, I believe I did this treatment. Just after Dr. Tanner's appliance. That's it. That's all I did. But look at the postural changes, the jawline change, the nose, the lips. Like, people thought I got work done. I'm like, oh my God, I needed so much work. But everybody thought I had a lot of work done because I didn't realize how forward my head posture was. And I know I'm a class 2 and I understand that, but it was mid face that I needed growth. And I got to tell you guys a story actually. When I was in dental school, I really wanted to become an orthodontist. And when I went to my ortho clinic and I told them, I want to go to ortho and I need ortho, can you work on me? Because I wanted to get into the ortho clinic, and say, oh yeah, piece of cake. You're a 4 bicuspid extraction case. And I was like, oh my God. I was like, okay, what? You're gonna extract 4 teeth? Um, I'm like, okay, I mean, they're the experts, but I had one question, it was very superficial. I said, what is my side profile gonna look like? Because if you pull this premolar, this is gonna come back. They're like, it may or may not. You may look the same or may be a little, like, come back a little bit. I'm like, but my nose is gonna look bigger. They're like, no, you'll be fine. And that did not settle right with me. And at that point is when I learned, talking to my preceptor, that you can do orthodontic treatment as a general dentist. And that's when I was like, sign me up. What do I do? And I started learning about ortho while in dental school with somebody else. I did another mini residency, and I'm so glad I did. And I said, I will never pull teeth because that didn't settle right with me. I didn't know anything about Airway. It was from a very superficial standpoint of view, but I'm glad I went with my gut, and I'm glad it was a little superficial because, yeah, it was a game changer. So anyway, that was just a little side story to share with you, but I'm so glad I did not get my premolars extracted. So this is my Ceph before and this is my Ceph after. I want you guys to look at the significant changes it's had on my posture by wearing the appliance. And I actually wore the appliance for probably about 8 months. It did break because I wore it so much, but because I love the way it made me feel, right? I'm a class 2. I had lack vertical, so the appliance gave me vertical height. I felt great with it. It did take up a lot of space for nighttime. My husband did say I was snoring more. But I was like, hey, it's just temporary. It'll be fine. And it was. It was temporary. As soon as it came out, tongue went on the roof of the mouth. It was great. I had done myo and tongue tie release 8 years ago, which had helped me tremendously. But this is what I was missing. I was missing mid face growth. And that helped bring that jaw forward because it was trapped. And now I'm trying to work on getting my vertical height to maintain what I had gained from here. But I only created maybe 4 millimeters. I didn't do very much, but that's all my tongue needed. And look at my hyoid bone. You can't physically take an x-ray and say, you know what, I'm going to move my hyoid bone up, not take the x-ray. You physically can't do that because, like I told you before, it's attached to 12 different muscles. So everything changed for me, guys, in a really good way, and it does change for my patients as well. And so this is what I'm looking for when I am looking at postural changes. And I'm learning more about spine. Again, something that we don't diagnose, but this is something we need to look. I still need so much more work, but it is a lot better than before. But yeah, so that was my journey, and it was a huge game changer for my jawline. And that's where everybody started thinking that I got some fillers in the jaw or chin or that. I'm like, no, it's just literally repositioning the lower jaw. And this is what we can do for adult patients as well. And there's a little bit of anatomy for you guys to really understand, like this is where the hyoid bone looks, and these are just the anterior muscles. You can't even see, oh, you can see the posterior muscle attachments to the hyoid, but there's even more. So this is just a small picture to show you how many bones or how many muscles are attached to the hyoid bone, which is kind of cool. Okay, this is my last slide. So this was to show you that expansion in adults does change the face, especially if they've had retractive ortho done. And I know a lot, there's controversy that retraction does not cause sleep apnea. Okay, so we can argue, we can argue about that. But you know what you can't argue is the facial changes and the postural changes that patients are seeing and that we're physically seeing. You cannot argue that. This was a patient who had retractive ortho done. Everything relapsed back and got even tighter and smaller. Lower jaw went even further back. When she look at her positioning and look what it had done to her. Her jaw, I know her TMJ and her temporal bones, everything is messed up right now. It's not going to be perfect, but it's getting better. And all I did was just expand her. I did do lateral expansion for her and a little bit of forward growth. I even expanded her lower because she was so narrow. And again, not perfect, but you can see the facial changes happening just by doing expansion in adults. So expansion is possible in adults. I hope I got that point across today.
Mandy, that was awesome. Thank you so
There's
much.
so
Wow.
much.
Wow, those are great cases.
Honestly, I'm not just saying this, like you're not paying me to say these things. But it's literally been a game changer for my practice. Just from the simplicity of using it and then being able to train my staff actually to use it, I'm actually able to treat more patients, right? And I have a lot, like you have a lot around out of town patients. So you gave me the idea. I send them, like, thank God for Amazon. I send them tiny little nose pliers, actually jewelry little nose pliers. They bend the wires themselves. If it gets loose, we go over it via Zoom, and I've taught my team how to do that. So I'm able to treat more patients. So I don't have to see them in my chair every 4 weeks. If they can, I tell them it's obviously beneficial, but a lot of people can't, right? So I could treat, and then clear liners, they come in for a scan and I could ship the liners to them. I have people coming, you guys don't know our anatomy, sorry, our geography, neither do I, but we have people from Thunder Bay, which is like an 8-hour drive. And there's no way that they can come to my office. So we literally ship everything to them. They can make 1 or 2 visits. They can't come see me for follow-ups all the time, right? It takes time. So that's what I love. I love your appliance for that. Fixed is really challenging to do that for out of town patients. And you're not getting that 3-dimensional change that we're getting with your appliance because of the occlusal pads, because of the forward growth. And I think that's been a game changer. So thank you.
Yeah, awesome. Ryan, do you have any questions? Michael, do you have any questions for Mandeep?
I
When did
think
you
Mike,
start doing doing this type of treatment? I'm actually I grew up in Oakville.
you did? Okay, you're not too far.
My parents still live there.
Oakville's an awesome place. And so where are you located now?
Asheville, North Carolina.
Oh my God, we love Asheville. I hope everybody's okay. I heard about the hurricane.
Yeah, it's been rough. Um,
I'm sorry.
yeah, thanks. But we'll recover, but it'll take a while, I think.
It's beautiful. It's absolutely beautiful. When I started, Nate, I don't know when I started this. I started a long time ago because I started with my son Jaden. Um, it's been a few years. I don't know actually. I've been doing it for so long with this appliance. I don't know. When did you first start this? When did you start, Nate?
Like 2019, I think.
Okay, so then I must have started Jaden. I could pull it up actually. Oh, I don't have the dates on it. Because when I usually present with my son's case and the forward growth that we got for him. And let me look at his age.
Looks like maybe like February 2021,
Oh,
somewhere
oh,
after that.
okay. 2021. That would make sense because how old was he here? He was 8, and he's 11 now. So yeah, I think that makes sense. So let me just quickly share. I can share this with you again. Um, is that okay? I'm just going to show him. I'm just
Yeah.
going to show them my son's. So I had done expansion for him in 2017. So yeah, it was 2021. So we started actually beginning of 2021. That's when we started. So I did the whole bio block thing. Like I work with Dr. Hanks. Like we've done the same courses, Nate. And so I was really grateful for that because look at my son's carotid teeth at 4. And then look at the amount of spacing we got, everything exfoliated naturally, helped him with his sleep. My son did have sleep apnea. But then I was like, oh, his profile, like, how do I grow this? And it's really hard. I tried every single face mask there is in the world. I promise you, I've tried every one. You name it, I've tried it all. And it just didn't work for this kid. It just made his posture worse until, thank God, I met Nate and I was able to get him this appliance. And we did 2 rounds of this for him in order to get him here. Like, it was a game changer and is
That's really
literally
cool.
shape. Yeah, I still need to do way more. By all means, my kids are still mouth breathers, don't judge. But it's but I'm grateful for every little bit that I've been able to do for them. We shouldn't really aim for perfection. It's really hard because then why would we keep learning, right? That's why God gave me these children so I can keep learning. It's a lot of work. But that's how I got into the whole postural stuff, right? Like that's how I got into the whole postural stuff. Like his feet were super flat. If flat feet, is it ascending, is it descending issue? So then that's why I started working with a lot of athletic specialists and osteos that started helping with his flat feet. Um, Actually, if you guys are interested, I can easily show you the changes in his feet too. It's actually the next slide. Can you guys see the changes? So this is his before and this is his after. He's still flat-footed. Like we're still working on it, but this is prone to injury and he's a really good tennis player. And I was like, there's no way. So we worked really, really hard working with an osteo, getting some proprioception, insoles, and yeah, I'm still working on it. It's not the greatest, but this kid is so lucky. Like he doesn't know that every little bit we're doing is making a big difference, but breathing is so critical for him.
That's
So
cool.
yeah.
Thanks for showing us.
Yeah, no, you're welcome. Thank you for asking. This is totally my jam. This is what I do. Like I love it. And using these appliances has just been really easy and just amazing.
There were a couple of situations you talked about, it sounded like a face mask. I wasn't sure what that is.
Yeah, oh, like a reverse face mask. So I don't think I have any images of it, but like sometimes you really need to get that maxilla, the whole maxilla to move forward. I don't know, maybe Nate can talk more about this, but like with the appliance, I can only get the pre-maxilla to move, but sometimes like to open up the airway, or if there's not enough room for the 7s or the 8s, I use a face mask. But
Is
I
that
don't
what we would
use
call
that.
headgear?
So it's not, headgear pulls everything back. This is a
Okay.
reverse face mask, yeah. So this
Okay.
does hold the chin in place, but we put elastics at the front. I'll try to
It's
look.
the thing that has like a pad on the forehead and the chin and
Yeah,
okay.
I've even done them where I've worked with this thing called the crane. I don't know, Nate, have you heard of the crane? Where it actually, instead of using the chin and the forehead, it's like a neck brace.
Oh.
Okay, no, I haven't heard of it.
Oh my God. It's a neck brace. It was horrific to use. I've tried everything because I've done a lot of like ELF courses as well. So I worked with Dr. Derek Nordstrom and Angie Tanner. So 10 holder. So she taught me about it. And there was another one that I used. I don't know if you guys know who Dr. Sandra Kahn is. She wrote the book Jaws. Have you guys read the book Jaws?
Oh
It's
yeah.
really, yeah, it's a
Mhm.
really good book. So she was one of my mentors as well. She's like, hey, Mandy, do you want to try out our prototype? I'm like, sure, anything to try another face mask for my son that would work. And it's one that you strap onto the chest, and then it has
Oh
like
wow.
a piece that comes out this way from the chest, and then like you hook the elastic. I'm like, oh God, how is he gonna sleep with this? It
That
was
sounds awful.
Oh, it was. It was a nightmare for me. And
Mm,
her, he was young, so we tried everything. At that point, he was like maybe
mhm.
like 6 or 7. She's like, you got to make straps and sew it onto his like shorts or something. I'm like, yeah, I tried. It didn't work.
How
So
are you gonna get a patient to do that?
you know what? It's a desperate mom.
Mm,
She will try anything. Okay, that's
yep.
Nate. A desperate
Mhm.
mom. Well, that's why when Nate's like, Mandy, try this, and I'm like, oh, this is so easy. You just clip it in and you just get this growth. Oh my God, sign me up. I don't need face masks anymore.
Mhm.
So, and you saw that case that I showed you with that 13 or 12-year-old girl. I didn't use a face mask for her. I was able to just use Dr. Tana's appliance. She would not have been compliant with the face mask. Some girls are really challenging, like teenage girls, very, very
Mhm.
challenging cases. But yeah, these are good questions. Any other questions?
The other thing I was wondering about, there was the one case that there was an adult, I think it was a female that you expanded the lower as well. Did you use the Schwartz for that or was it something else?
I did use a Schwartz for that, just a regular.
Okay,
Yeah, just
cool.
use it. And it's so slow. There's no recession. And everybody gets spacing differently when I use it, but she literally got gapping everywhere, not just in the
Hmm.
center, which is really cool. But again, no recession. I don't know why people think you keep getting recession. I don't know, Nate. Have you gotten recession cases?
I've had one case with some recession. That's it.
Maybe it's
Yeah,
orthodontist spreading rumors.
yeah.
Well,
Even
recession is common. Recession is
Mm.
common in orthodontics in general, and so everybody's afraid of it. And this is
Mhm.
something that's a little outside the mainstream, but it's becoming mainstream over time.
well, we're trying. I mean, it's just that we're getting a lot of pushback, so. But I don't know. I try to stay under the radar as much as I can because, our regulations here are different. I'm not doing anything that's not regulated. Like I'm by the book, but, orthodontists get wind of it. They're like, how are you expanding? This is impossible. And then I had to do CBCT scans on all my patients. And I told you it's impossible in this country to begin with to prove there's no bone, there's no recession. So I really don't want to go that route because then that means I'm putting my
Mhm.
patients out almost like $600 plus a drive all the way down to the main city, which is, well, Michael, downtown Toronto is where they have to go.
So you're not
So
allowed to have
you
a cone beam there.
I can have a little one,
Oh, okay.
but I cannot have
Oh,
this. I
wow. Huh.
can't, yeah, so I can't have full,
Interesting.
yeah, I had to be very selective. So that's why I apologize. You had to sit through my cephalometric x-ray.
No worries.
they were really cool.
Yep, that's awesome.
So embarrassed. I'm like, oh my God.
No, they
But hey,
show
that's
the
like
airway and the spine really well. I mean, you could see
Yeah.
what's going on.
Hmm.
They're great. The occlusal plane, the mandibular plane angle. I mean, it was awesome.
thanks,
Yeah, I
Nate. I
was thinking
appreciate
I have a cone beam, but I was thinking, huh, I'm not sure I can see the highway. Have to make sure I get down far enough.
That's true. See,
Uh,
now you're gonna miss the supplementric X-ray.
mhm.
You can be like,
Yeah.
Exactly.
damn.
So there's a lot to be said for this stuff, I think.
Or we'll have to take two. We'll just have to have their head touching the top, and then have like a together.
Oh my gosh, that
Uh,
would
Sorry,
never fly here.
Dr. Joel, you're gonna have to take about 18.
yeah.
I thought about it. I'm like, I want a machine so bad, but I'm like, I can't. It's just a small field, and it just makes me so angry that I can't do full field. So
Uh, it's so annoying.
one day, maybe my
Yeah.
children will be able to do it. Maybe it will be. So this is great. What a great group. So how many cases have you guys done?
For me, very few. I have 3 going right now, so I'm just starting out.
Oh, you won't regret it. Are you doing children? Are you doing adults?
2 of them are my kids that are 4 and 6, and then the other one is my assistant's kid who's I think he's 12. So, yeah.
I think that'd be a really cool case to see the 12-year-old because all adults either gonna be coming in. It'd be really cool to see the change.
Mhm. Yeah, he has a lot of, kind of the classic signs of sleep stuff, so when I was talking to her about this and we had a training with Dr. Tanner, and she's like, "I really need my kid to do this," so I'm talking to patients about it. I have one, um, one person I think is very likely gonna do it for their kid, but we have to get through the process of, talking about it and consulting and stuff. And
Yeah.
then, a couple others that I'm working on, but yeah.
Once, like, I feel very fortunate. Like, I got into the whole tongue tie world in like 2017, and then I was just able to grow from like referrals. So now it's to the point where if anybody wants to, they have to pay for a consultation. And then if they want a consultation, or they can go straight to ortho records, but that includes a consultation fee. So they had to pay for all that. And there's a wait list. So they just
Mm.
sign up because I cases now. So it's just only a matter of time till you get there because the results are so amazing.
So would you say this is a pretty big percentage of your practice now?
Personally, for me, yes. So I
Mhm.
like my column now is just ortho tongue ties. I also see babies. I do baby frenectomies as well.
Okay.
So my column is purely ortho and tongue ties. I do also deal with like concussion patients, like postural balance. So I have like another appliance, like a postural positioning appliance.
Hmm,
Um, but really that's it. But my associates
nice.
now are doing all like the bread and butter of dentistry because that needs to be done too. I love crown and bridge,
Mhm.
but there's just not enough of people that will do what we're doing. So that's, school teaches crown and bridge, so I can dime a dozen.
Yep, you can hire anybody to do that. Yep.
I mean, I feel bad, but it's the truth, right? So
Mhm.
we need more of
Yep.
us. So it makes me so happy that you guys are getting into this. And Nate, I love the work you're doing and just spreading it.
Thanks, Mandy.
Mm.
This is amazing. Yeah, you let me know how else I can help you, to share it on a larger screen, on a larger stage, because I will definitely help you with that. We can get more people on it.
Yeah, awesome. No, that's great. Well, thank you guys for joining. Yeah, I appreciate it. Do you guys have any
Yeah,
case
thank you.
questions about any of your cases or?
All right, now I think that the girl I showed you, that you said it's the smallest mouth you've ever seen. I think I'm gonna do her case. So that's really cool. I went over during the hurricane to her. They're my next door neighbors, and I went over there during the hurricane and talked to mom about it again. And she's like, "Well, I guess it's just a matter of getting to your office." I said, "Yep."
Is that the cleft palate girl?
Yes.
Mm.
Is it okay if I show Mandeep that case?
Sure, yeah.
Well, what's her name?
Israel Toller.
Nate, when cases that are so narrow, I've been doing lateral expansion with like the bile block. and then using your appliance.
Oh, okay.
Because sometimes, like especially in my adult patients, I have an adult who is 24 millimeters wide.
Wow.
Whoa.
I can't even make it up. So there's no way I could get her into your appliance because she had zero space for her tongue. So we did
Mm,
lateral expansion, and then I do forward growth extension. So a lot of my treatment now involves 2 removables when they're that narrow.
Wow. No, yeah,
Yeah.
that makes sense. Yeah, the smallest I've seen is 26.
Oh my gosh, I
mm.
should pull it up. I should show you
Um,
guys.
this Royale's her intermolar distance between the mesiolingual cusp of the second primary molar was 21 and 19 on the lower.
Wow.
You know,
Nate,
I kept on.
I'm gonna
I'm
show them my 24 millimeter with this case right here. Can you
Okay.
see it? That's how narrow she is.
Mm-hmm.
I
Crazy.
was I was like, oh my God, there's no way I can get any of that in you. So I'm so
Oh my
and
goodness. She
That's
is
yeah,
pretty
so
narrow.
narrow.
Mm,
like isn't this insane?
that's
24.
wild.
It was crazy. So I was like, I need growth in every dimension for you, like forward, lateral, like she has no sleep. Yeah,
I can
so
share my
Mm.
screen, Nate, too, if you want,
Oh, you can?
if that's easier.
Yeah, go for it.
I'll try to do this. We'll see if it works here. And I apologize for the hair in the picture.
Your hair?
No, that would be really weird. Let's see. I can try. I'm not sure. Share. I'm working on seeing if I can allow it to do that for the program. So if you find it before I can get it figured out, Nate, then
Yeah, I found it.
oh, you found it. Okay.
let's see. Are you sharing it?
Yes. How'd you know? Let's see. Uh, okay.
A kid that can actually breathe, then and it's not even that it may or may not increase the size of it, but even if it does a better quality of life she's going to have because of her developed jaw is going to be so much better. She snores and
Mm.
always has her mouth open, breathing.
Yeah. Do you have a supplementric X-ray or a CBCT scan? Because I'd love to see what it looks like. What's her bone looking like?
So this was next door neighbor dentistry. She came over and took the pictures. Actually, I've never seen her at the office of the patients, but don't tell anybody that.
That's okay. That's family and friends. That's what we do. That's different.
Mm.
Oh my gosh.
Okay, so they're gonna move forward. Mandeep, have you seen anything like that before? What are your thoughts on that?
Like I said, that I can't touch on that territory. I've had a few, and those type of cases are fully funded and covered in Ontario by sick kids or like major hospitals. So the parents will never pay out of pocket for treatment for kids like
Mm.
that because they don't understand the ramifications of sleep. You know, I mean, think about our adult patients that are prescribed a sleep app and they're like, oh, I'm fine, I don't need it until they're not, right? So it's unfortunate, but I've just learned now that I just say my piece. I've literally lost, I don't know if I told you, I've literally lost patients because they're my in-house patients that, you know, I always encourage second opinions. That's another thing that I do. I wanted to let you know that I encourage, hey, go for second, third opinion, especially go to an orthodontist because I'm a general dentist. I'm not sure if you guys are orthodontists or general dentists, but it's important that they
Mm-mm.
really know that we're general dentists, especially with the rules here. And I'm like, go see an orthodontist. And the orthodontist only takes pictures of their teeth, only looks at the teeth, doesn't look at the body as a whole, doesn't ask what their sleep. I already know those things. But some parents are like, oh no, but he's an orthodontist. They did so many more years of schooling. So they said my son should get 4 teeth pulled. And I'm like, I'm not pulling out your son's teeth. And they literally left my office because I refused to pull out his teeth, even though I showed them cases and I showed them we could do it without.
Mm.
But the dad had already paid, so it was already done. And I was like, yeah, I can't have that on my conscience. That's on you. Like, I can't. Oh my God, look
Mhm.
at the posture here.
So this is the other case I started. He kind of disappeared on me, and then I saw him a few months ago. Actually, no, it was like 3 weeks ago. And his mom was like, "Oh yeah, we decided to go to the orthodontist because they take our insurance."
Oh
And
boy.
I was like, well, I'd be happy to continue our arrangement that we have to keep treating him, but just and the pre-treatment photos I think were in like maybe November, and he started maybe in like December, so it was only like 4 months. And he keeps losing his appliance. That's the other reason mom's like frustrated about it. But check out his front teeth. He grinds his teeth at night.
Mm.
Um,
Can you guys see my screen? Okay, I'm not sure
yeah.
if it's
Yes.
It looks good.
Mhm.
and it doesn't even look like anything has changed, but his lower jaw has moved like so far forward compared to where it was. Just
Mhm.
followed his upper jaw. And I didn't do anything on the lower yet. And I told them, I was like, hey, I really want to make another appliance for the lower so we can start helping the lower out. And mom was like, yeah, I'm gonna think about it. So I hope they come back because
Mm.
I'd really like to help them. But I don't know. I've never seen front teeth um, worn out like that, and such a dramatic change in like not even 6 months.
Wow.
That's amazing.
Nate, do you do fixed for the lower or do you do removable for the lower if you do it?
Mostly removable. I have done a few fixed. We're starting to make some like Alf Crozat appliances, some light wire. So if you want to start trying some of those, we just bond a little composite on the lingual of like the canines or the E's or sixes, and then do some clasps for retention because those are like lower profile and you could bend them to get different developmental forces.
Wow. Can you share some of those with us? Can you show us those?
I don't have anything I could pull up right now, but yeah, we could put something together and show. Yeah.
Yeah, that'd be really cool to see because I'm still doing like the shorts, like it's still a lot of acrylic. And then I do like a fixed lower for like for these little kids. If they're losing the upper, they're gonna lose the lower too. So I'll just
Yeah.
do like a fixed lower, like a Williams, just to get, just so it's there. I don't have to worry about it, but I'm just trying to think of something simpler.
Yeah, because I've had some of those where it's like they loosen up from all the rotation or the tongue pushing on it, and then they halfway come out and they're 6 hours away, and it's just a big inconvenience.
Mm.
Mhm.
So yeah, so I'm thinking like doing the Alf Crozat is gonna be nice because it's way lower profile. It can stay in and less likely to lose, hopefully.
Yeah, I would love to see that.
Yeah. And this is Michael's cute daughter. Isn't she adorable?
One of
So
my
cute.
two offspring. Well, she had a crossbite on the upper, and I put her in appliance for about 5 months, I think, 4 months, and that's where we ended up. Um, and she's still wearing it at nighttime, but um, she like has tongue spacing, and like her lower jaw's huge, but her upper jaw was trapped, and she used to suck her thumb, and I think that was a contributing factor to because she would fall asleep with her thumb in her mouth, and then it would kind of just rest right there. and I think it prevented some maxillary growth, and it allowed those lower molar or the upper molars to get trapped inside the mandibular molars. So, but those are the 2 cases I've done. That's the only 2 cases I've done so far.
That's amazing. Look at that palette. That's so cool. It doesn't
Yeah.
take much. That's what I love about this appliance too. It doesn't really take a lot.
I'll stop sharing my screen here if someone else wants to share.
Yeah, that's great. Ryan, your turn.
I don't have anything on me, sorry.
Okay, now you're good. Mandy, thank you so much. That was awesome. Did you guys love that?
Oh yeah.
That's awesome. Thank you for sharing.
Oh my gosh, you're very welcome.
Yeah, that was good. Okay, well, you guys
Yeah.
have a great night, and
Thanks,
we'll
Nathan.
do this again. And it was wonderful seeing those cases. Those are amazing.
Yeah,
Thank
I'll
you.
keep you guys updated on Israel's too, because I mean they're actually out of town. The kids are out of town because of hurricane stuff, and I don't know when they're coming back, but probably not that long. So, but I'll keep you updated on her, and I'm gonna take a CBCT of her before we
Nice.
start.
Cool. Can't wait to see it.
Awesome. Cool.
Awesome.
Thanks,
Alright.
Nate.
Well, thank
Have
you,
a great
Okay.
gentlemen.
evening. Thanks, Mandy.
Sounds good. Thanks, guys.
Mandy.
See ya.
Bye-bye.